brief demonstration of RST, Resonant Sound Therapy, and a couple of kind of introductory pieces of information. This therapy can be done, anywhere, any location, any circumstance. But what I teach in my work is that if you're able to follow some basic guidelines that I give and apply them both for yourself and in therapy, you will find a significant increased advantage. So the basic guidelines is, one, if you have a cell phone, we actually don't want it even in the room. Even if it's in the room turned off, it generates a field which is very disruptive to energy. And so no cell phones. If you're wearing jewelry, we ask the jewelry be taken off, because most jewelry is electroconductive, and the energy flowing through our body has an electrical charge. And so the jewelry that surrounds a finger or a wrist or the waist or a toe disrupts the flow of chi or life force. It creates a warping effect. We also ask that you wear loose, comfortable, natural fiber clothing rather than synthetic clothing. Not to wear any strong perfumes or deodorants that are synthetic, because they're also very disruptive. So when we do this work, we do it grounded, and I just want to show you that I'm wearing a moccasin. These are just pure leather, inside and out, all the way through, and this is tile floor. This is a grounded space. Whenever possible, we want to do this work grounded. If a moccasin is worn in, then it's a grounded material. So what I ask patients to do is that every time you take a breath in, you're taking a breath in. But every time you take a breath out, I want you to make a specific vocal tone, and I'm going to give you the tone, and then I'm going to start to make a complex resonant overtone to create a body harmonic. The purpose is to find and to release fascial torquing. What I contend is that fascial torquing is what causes physical, emotional, mental, spiritual injuries and traumas, and we unwind it. So the bass tone is So while the patient is toning, and normally I'm toning, sometimes I stop and share information. Most of the information I share is visual in nature. It's really just a description of energy flowing through the body. So I'm actually pulling the fascial membrane, the connective tissue membrane, right under the skin to its natural stretch in one direction and the other direction. So back and forth across the spinous process, and then I start to move in a moboid manner. It's basically a figure eight between the two hands. So this is creating a connection between the fascia under each hand, that I can start to feel the tension points, and I can start to unwind. So in the spiral, in the mobius, to remember. And then in every treatment, this is just a brief sample, but I like to set 3 energy pumps. The first pump is the sacro-occipital pump. So my left hand, I'm gently rocking the sacrum. My right hand, I'm gently rocking the occiput, the base of the skull. And the energy that flows between the sacrum and the occiput is a syncopated pulse. Syncopated pulse. So it's like a waveform that moves back and forth.
You can put your wings right here.
You can leave them there. That would be fine. Thank you. So this is the first pump I want to open up. And then the second pump is the craniosacral pump. Filling the entire skull. And then I always like to reinforce the basic movement of chi or life force or spirit through the body. So my fascia grounded to your fascia, counterclockwise inflow. So this is the way chi or life force flows into the body through kidney 1, this acupuncture point on the bottom of the foot. It flows from the earth through the body, and it's flowing counterclockwise up through all the meridians and chakras. And at the same time, there's a life force spirit that's flowing clockwise. That's the outflow. So we have inflow, outflow, inflow, outflow. So there's a whole basic of series of kind of things that I like to do in an extended session when we're doing a focal session. So the RST sessions can be as short as 15 minutes, as long as an hour plus. And in this case, I just wanted to do that brief demonstration, and then we're going to go focally to where you're actually struggling.